Welcome, everybody. Welcome to the medical symptomology series. Today's topic will be on seizures. As I'm taking medical symptoms one by one, in which you will get to know more about these symptoms, what causes these symptoms. Seizures. Seizures are sudden episodes of abnormal electrical activity in the brain. These can cause dramatic involuntary contraction of many muscles in the body and, if severe, result in convulsive movements of the limbs and trunk and can render you unconscious. As in the animated series, you could see there are two human beings where both of the convulsions are occurring in their muscles, and these are involuntary in nature. That means the person doesn't know that these things are happening in him. These fits are happening, or these seizures are happening to the person. Another case is a small girl child where the girl child is being irritated or bullied by her friends, where she's getting seizures, and these girls are laughing at her. This can cause social anxiety in some of the individual. Seizures, based on the number of episodes, are classified into multiple episodic seizures and single episodic seizures. As in case of multiple episodes, you have two cases where there is epilepsy. In multiple episodes, you can find epilepsy and preeclampsia. Epilepsy, the seizures may be short lived. There could be loss of awareness along with twitching of the face and limb, and generalized seizures with loss of consciousness, uncontrollable jerking of trunk and limbs. And it could be a medical emergency if it is the first attack, or it could be another segment emergency where the consciousness does not return within 5 minutes. The person does not regain his full consciousness. As in case of preeclampsia, this happens in a pregnant woman, where the pregnant woman and the child both are affected. The pregnant woman gets fits or seizure attack. Next comes is the single episode of seizures, high fever and severe heat stroke. As in case of head injury, the seizures could be there which could render you unconscious. This is another medical emergency condition. It could be the head injury may be preceded by a headache or drowsiness or confusion, nausea, vomiting, or there could be some kind of bruise or bleeding at the injury site, or any kind of clear fluid or blood leaking out from the ears. And this could render you into seizure like state, where the injury is actually happening to the head and the electrical activity of the brain is hampered, which has caused the seizures. Then in case of stroke, in stroke there could be a paralysis of one side of the body. There could be slurred speech, difficulty in swallowing, double vision, and drooping of one side of the face, which actually has affected the brain electrical activity and has caused seizures in that individual. And these seizures could be common, and it could last for weeks following a stroke. Next case is in high fever. Seizures appear at a temperature over 104 degree Fahrenheit with chills, headache, weakness, poor concentration, sleepiness in the day. These high fever content happens in single episode, means high fever could cause a single episode of seizure. In severe heat stroke, there could be shallow breathing or confusion or disorientation due to the heat of the sun, and you're having heat stroke, severe in kind, which could render you unconscious and can lead to a seizure attack, a single episode that too. Another case would be alcohol poisoning. Alcohol poisoning, in the alcohol poisoning, there could be a seizure attack, maybe preceded by confusion, which has hampered the electrical activity of the brain. There could be slow or irregular breathing. This is a medical emergency condition. Then the next condition, it could be a drug overdose. Seizures and unconsciousness might occur due to the drug overdose. It could be due to paracetamol drug overdose or any other drug overdose. It could be preceded in a drug overdose case, means you have taken the medicine in double quantity and it is caused overdose reaction. There could be rapid heartbeat due to it, chest pain, diarrhea, breathlessness, and even a seizure attack could happen. This is entirely serious condition. Then in abrupt drug or alcohol withdrawal, if you're having medications for antidepressants or anything, and you just or any kind of alcohol and you're having withdrawal symptoms, and withdrawal symptoms could have seizure attack also. That could be preceded by restlessness, tremor of hands. Then in case of encephalitis, there could be a flu-like symptoms. Encephalitis, another brain infection where you could have fever, headache, and a seizure attack also, that too a single episode, or it could be a multiple episode too. Then comes is hypoglycemia, low sugar count. If you're having low sugar count, that is hypoglycemia, it could lead to lightheadedness, seizure, unconsciousness, confusion, feeling of hunger is always there in low sugar count. It could be sweating, nausea, shaking. So those who are actually diabetic, this is actually related to who are associated with diabetics. So they could have severe or untreated hypoglycemia, which could cause seizures. It could be another reason for a seizure attack, that to a single episode. Then in case of meningitis, in meningitis, there is general neck stiffness, fever, feeling very unwell, light hurts the eyes, may have a rash that fades after pressure and is briefly applied. Seizures tend to occur in severe cases that do not receive prompt treatment and may rapidly result in death. Brain tumor. Seizures associated with headache worsen by bending, coughing, or more severe in morning and with increase in frequency and severity. Other signs could include nausea and vomiting, personality change due to that brain tumor. There could be slurred speech, weakness, or paralysis of one side of the body due to brain tumor. Another thing is that three medical attention seeking condition, even though seizures is completely medical seeking condition where every time you'll have a medical seeking uh, attention needed in case of a seizure. It is when it is the first time the person has had a seizure. These three conditions where there is urgent medical attention needed. It is the first time the person has had a seizure. The seizure lasts for more than 5 minutes, and the person does not regain full consciousness after the seizure attack or the fit attack. These are the things which you need to know. Thank you, everybody. If you like the video, please do like, share, and subscribe to my channel.